Canada's new COVID-19 tracing app is facing criticism just days after its rollout began. Users who download the app are alerted if they come into contact with someone who later tests positive. But some are finding the app is not accessible. Our Laura McQuillan has the story and joins us now. So Laura, let's talk about the issues that are faced with this app.
Yeah, it all hinges on the type of phone someone is trying to use when they go about downloading this, because it does need a specific type of operating system and it has to be pretty new. And what we're hearing from experts is that that could exclude older Canadians if they're using an older phone. Same with marginalised groups, those same groups that are hardest hit by the virus. So the COVID Alert app needs an Android or Apple smartphone. It only works on an Android 6 or later, an iPhone 6S, so those have to be made in the last 5 years. If someone hasn't upgraded their phone in the past 5 years, they simply cannot download it because of their operating system. And someone who's already seen this issue is an Ontario MPP, Merritt Stiles. She says her parents both having difficulty trying to download it. Take a look at a tweet that she sent out, and that she said her parents, aged over 70, tried to download it. Only works on phones with a certain Apple operating system, which effectively excludes anyone with an iPhone 6 or earlier. So the government's created an app which people can't use without higher-end iPhones. And what one tech expert is saying is that compounds the discrimination of this virus. That's Christopher Parsons from Citizen Lab. It's a tech research institute in Toronto. Take a look at what he told the Canadian press, saying that the worst affected by the pandemic are Black, Indigenous, people of colour, people who often have a lower socioeconomic bracket. He goes on to say, who's not going to be able to install the application? That same group. That's a problem. And he points out that this app needs about 65% of Canadians to download it for it to be effective for contact tracing. Right now, without everyone being able to get it, that won't be possible at all, he says. Now, I've reached out to the federal government this morning to see if they might have anything to say about that, whether they're working on a fix. Also to find out how many people have downloaded it so far, John. Waiting to hear back, but worth noting, it's only fully functional in Ontario as of now. Anyone can download it across the country, but you have to be in Ontario to really get the most out of it. But the Atlantic provinces will be rolling it out next.
Let's talk about privacy concerns, Laura.
Yeah, there have been a lot of those in the lead up to this rolling out, and that's something that privacy experts are still trying to assuage by explaining exactly how this works, because there has been a lot of confusion. But something that has been hammered home is the fact that this app does not know your name, your address, your location. You can see it on your screen there. I downloaded it myself to get a look at it, and that's what you're looking at, me scrolling through it there. Now, it uses Bluetooth to exchange random codes with other phones that you have been in proximity to, about 2 meters. How far Bluetooth operates. And if someone tests positive, they'll be given a code by their local public health authority that they enter into the app, and then it will ping those phones that it's had Bluetooth contact with to let them know they've been within 2 meters of someone for more than 15 minutes, that person has tested positive, and it will tell them what to do next. Go get tested, for instance. You're not going to find out who tested positive. You're not going to find out where they tested positive. It keeps that information anonymous. Now, that is something that privacy experts are really pushing right now. They, doctors, tech experts, all involved in the setup of this app, and they are encouraging people to download it, but of course, as we're seeing, John, not everyone can.
Thanks for this, Laura.